Hello, welcome to our Sit Down Sunday Q&A weekly session where we answer questions from you. This week we've got some great ones. We're going to be talking about delivering twins vaginally, if it's safe or if you consider it at all, or risks with that a little bit. And then also talking about teething, everyone's worst nightmare for those crabby, sleepless nights with their little infants. So,
if this is your first time meeting us, I'm Sarah. I am a board-certified OBGYN. First-time mom with another one on the way.
Yep, and I'm Kurt. I'm a board-certified pediatrician and dad, and we are
the Doctors Bjorkman. Okay, all right, let's get right into it. Our first question comes from Jenny Peterson. It says, is it a bad idea to try to deliver twins vaginally? If I choose to do a C-section, is it okay to wait till week 39 to try to make sure the baby's lungs are fully developed?
Yeah. So I'm going to tackle the lung development question first. So definitely there's a lot of lung development that really happens a lot throughout the third trimester. By the time you get to 37 weeks, which we say your term, and a lot of that lung development, kind of the benefits of kind of more time cooking, really is kind of gone from a lung development standpoint by the time you hit that like 38-ish week mark. And so kind of if you can make it that far, great. The other challenge though with twins, as so many people know, is that multiples often come early, so you may not get the option to wait till 39 weeks. If you can wait till term, that's awesome though.
Yeah. So let's talk about mode of delivery of twins. So vaginally, C-section, what are your options? So much of this depends on, one, what your provider is comfortable with, but two, and kind of more importantly, is the position of your babies. So if one twin, so twin A, we say A is the twin closest to the door. So closest to your cervix, the baby that would deliver first vaginally is twin A. So if twin A is head down and twin B is head down, usually a vaginal delivery is something most providers are comfortable with. You do a vaginal delivery twice. It's beautiful. It's so fun. Again, twins are always higher risk. Things can happen while waiting for second baby that don't happen when we're only having one, but generally position is going to determine options you have. So if they're A and B are both head down or vertex is what we call that combo, most providers will consider it. If baby B is now butt down, so
but A is still head first.
A is head down, B is not. So we call those vertex breech. This is going to be a provider, what's your provider comfortable with? Some providers are comfortable doing what we call a breech extraction. So twin A, head down, vaginal delivery, just like normal.
They've already paved the path.
Indeed. And so then twin B, who is going to be breech, your provider can sometimes physically reach up, grab those feet, and deliver the baby breech. Sometimes providers will try to turn the baby to head down after twin A is born. But again, there is some things that have to happen in coordination. And this is something some providers are very comfortable offering. And some providers are like, no, thank you. Because if something happens with twin B, and this is the same if they're both vertex, they can spin. Once twin A exits, there's all of a sudden all this room in the uterus for twin B to do their thing. They can spin, they can many things. And so that is a possibility. If both babies are breech, your provider is absolutely going to recommend a C-section as the safest mode of delivery for those babies.
Gotcha. And you said if A is head down and B is butt down, and A comes out and B can't come out well, or if they were both head down and then B spins to be butt down the second time through, what is the does that mean an emergency C-section then, or? Again,
this is what your provider is comfortable with. So again, if A is vertex, head first to vaginal delivery, and then B, if your provider's comfortable with a breech extraction, you're good, whatever way twin B comes down. If your provider is not comfortable, let's say twin B was head down and spun to butt first, or then dropped a cord or dropped a foot, or some other thing was presenting that made it unsafe. One of the risks of trying to have twins vaginally is you could end up with what we call a combined delivery, meaning you get a vaginal delivery for twin A and a C-section for twin B. Been there, done that. It sucks. But often if your provider is making that decision, it's because they're saying, hey, this is what's safest for twin B. Twin B needs to be out now. And we can do a C-section very, very quickly. Most of the time, if you are having twins, you're going to deliver in an OR, like they will roll you to the back, to the operating room, just because you are at higher risk of something going awry with this delivery. And so we want quick access to anesthesia, a C-section kit, all of those things. So I think your question, is it a bad idea to try to deliver twins vaginally? I don't think it's a bad idea. It just depends on, most importantly, what you are comfortable with in terms of risk and the unknown and this possibility of the unknown, as well as what your provider is comfortable with. That decision may be made for you if they say, I'm just not comfortable with a breech extraction or playing this what's going to happen game.
I feel like there are many nights in residency though where you came home after delivering twins and you just loved it as a provider.
I did, yes.
Okay.
I loved breech extractions and twin deliveries, and it's a little bit of chaos and often a lot of joy. I've seen wonderful things happen. I've seen very, very terrible things happen with twin deliveries. So you want to make sure you have an OBGYN that you trust, you are in a safe place with an operating room and all of those things. The second half of that question, just to touch quickly to add on, if you choose to do a C-section, is it okay to wait till 39 weeks to make sure baby's lungs are developed? ACOG, so the American College of Obstetricians and Gynecologists, actually makes recommendations for what we call medically indicated preterm or late preterm deliveries, and twins are one of the categories in that we think about and they have recommendations for. And so for twins, uncomplicated twins, so you don't have other health problems. Babies don't have health problems like growth restriction. You don't have preeclampsia, anything like that. It depends on what type of twins you have. So if you have di-di twins, meaning each twin has their own placenta and their own amniotic sac, the recommendation is to deliver those uncomplicated di-di twins between 38 and 6 weeks. So ACOG does not even recommend that you wait until 39 weeks because the studies show that really after that 38 and 6 mark, we are not gaining much in terms of lung development or other things like that. When you have different varieties of twins, monodis, monos, they recommend them being born even earlier. Or if your twins have fetal growth restriction, some other conditions going on, they recommend earlier delivery. So that is something that you can talk with your doc about, depending on your health concerns, what's going on with those babies in terms of when they recommend delivering those little ones. So wishing you the best, hoping for a smooth delivery, whatever route that they join us earthside.
Yeah, good luck with those two little ones.
Yes, yes.
Okay. Our next question comes from Yesenia Torres. She says, hello, happy Sunday. Happy Sunday back
Cheers,
at you.
yes.
I feel like my baby, who is 9 months, has been teething forever.
Oh, yeah.
Still no first tooth. He sometimes has low-grade fevers, but no other symptoms of illness. Can you go into teething baby subject? And then followed up, Becky Zahir says, same exact thing happened to us. He turned 9 months a week ago, got his first tooth yesterday, second popped through today. And Miss Amanda Brooke also says, same here, mine was teething at 4 months, but didn't cut his first teeth till 10. He's 12 and now it's about 6. So things about baby teething is the time that first tooth comes out can be incredibly variable.
Yes.
Actually, I remember Sarah asked me one day when baby Cease was little, she goes, hey, when is the first tooth gonna come?
I didn't know.
And I said, oh, anytime between 4 and 12 months.
And I still find it hard that that's like pediatrician advice. Like if I told patients, oh, you're going to have your baby between 4 and 12, like what?
But the truth of the matter is
apparently.
there's a big variation on when that first tooth actually comes through.
Right.
For us, it was 6 months on the dot, and baby's first tooth comes
Two.
through.
I did
Some,
2
it's
little
like
teeth.
just before their first birthday, all totally normal.
Yes.
The challenge with teething, as you are probably living, is that it makes baby fussy. They like
Crabby.
feel that kind of that pain as their discomfort. Some things that can help is like putting pacifiers in the freezer, giving them something cold frozen to chew on, to suck on, things like that. I remember I once had a patient in clinic said, oh, we like dip their pacifier in alcohol. Please don't do that. not a recommended way to soothe them.
No,
There's
no.
also the Oragel that used to be on the market is no longer recommended, and it's been
Right.
pulled off the market
Yep.
just because of potential dangers to babies. So like teethers are great, things they can suck on, things that they can chew on, putting
Cold
pacifiers in the,
fruit.
yeah, exactly.
Like just washcloth in the freezer for them to chew on, different soothy things to
If
chew on.
you feel like
Right.
the pain for whatever reason on a certain time is kind of like your baby just can't get through it, like a dose of Tylenol
Yeah.
is okay. Also,
Yep.
if they're over 6 months of age, you could think about ibuprofen, Motrin
We
as
did
well.
that.
Yep.
She got a couple doses of Tylenol or Motrin when we're like, she's really miserable. This is like next level miserable.
Yep.
You know, I think it seems like she's teething. Should we offer her, you know, a low grade fever? Would give her some Tylenol to help.
And the fever question comes up often. They've looked at that in studies too, like does teething, is it associated with fever? And like so many parents have this evidence of like, hey, like she's got a fever and a tooth comes out. As it turns out, they couldn't find any good link between the two when they actually studied it in a scientific way. And so I think the
funny.
fact of the matter is that young babies are just exposed to lots of
Viruses,
viruses.
sure.
They get something that gives them a little fever at the same time as they're teething.
And then they're extra crabby.
Yes. And so the fever itself isn't dangerous to them either. If
Right.
they're like miserable to the point where they're not eating, drinking well, you could also think about using Tylenol
Yeah.
in those instances too. But we definitely realize there's a lot of people who have to deal with this. Actually, all of you who have a little one have to deal with a baby who's getting teeth. There's a spectrum on that. Everyone goes through it a little bit differently, but
Yes. So that is what we have for you this week. Thank you for all your questions as usual. Keep an eye out. We'll put up a new question box here so we can get some new questions from all of you to get those answers. We will have new content coming at you on Wednesday with our kind of weekly pregnancy educational topics. So we look forward to sharing that and seeing you tuned in then. Have
Bye,
a great
guys.
week.
we're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider. Right?
Yeah.
I'm doing teething,
Yes.
and you're doing.
Twins.
Do you wanna go
Having
first?
twins. Sure.
Okay, you go first. I'll introduce us. Delivering twins vaginally.
Yes.
Okay, great.